In this quick video, I'm going to talk about 5 things that really helped me make the most of my clinical placements as a 4th year medical student, and I think number 5 is especially helpful. If you're new to the channel, welcome. I'm Esther, a 5th year medical student at the University of Otago, and my goal here is to share my experience and equip you with valuable knowledge for your health site or medical school journey. So if this interests you, consider hitting the subscribe button. So getting straight into it, my first tip is to revise relevant examination skills and history taking skills for each rotation early on in the run. In 2nd and 3rd year, you would have learned quite a bit about history taking and examination skills in different specialties, and that comes in very handy when you're going through your clinical rotations. I found that the earlier I revised in the run, the more confident I felt in my interactions with patients during the rotation, and the more valuable practice and learning I got from those experiences. My second tip is to be as engaged as much as you can. In a clinical setting, obviously patients and their health are everyone's most important priority. And since we're there to learn, it's possible to feel a bit neglected when things are getting too busy. A good tip that one of my consultants told me was that the more engaged we are with the doctors and the patients, the more engaged the doctors will be with us. And so being interested in the patients is a really great way to help make your experience a lot better. Moving on to the third tip, which is to ask questions. This is a great way to show the doctors that you are engaged with what's going on. It's pretty helpful to ask questions that are patient related and timely as well with what's going on. A good time to do this is when the doctors aren't too busy, and if you're not sure if the doctor is busy, a good phrase that I like to use is, when you're free, could I ask you a question? And it's helpful because it lets the doctor know that you have a question and they can try to answer it when they can. My 4th tip is to learn to balance your time well. Like we talked about in my other video about how 4th year is different to previous years, on busier rotations there can be quite a lot fighting for your attention. The goal is to spend as much time as you can in the clinical environment learning from patients and the doctors, while being able to have enough time to finish all your assignments and get prepared for your exams. Finally, my final but very important tip is something that's very helpful to do when doctors are busy with something, with some admin, and there doesn't seem to be much for you to observe or participate in. This is a good time to ask whether there are some patients that they recommend talking to or examining, and then you can ask the patients if it's okay with them. I highly recommend talking to as many patients as you can because there's so much that we can learn from them. The more we practice our history taking skills and examining skills as a student, the better we will be as a doctor in the future when everything matters. Finally, if you're starting 4th year soon, check out my video on a closer look into 4th year and how it's different from the first 3 years of medical school in New Zealand. If you found this video helpful, please give it a like and subscribe to the channel, and thanks so much for watching, and I'll see you in the next one.